Okay, let's see. Alrighty, we'll get started. Okay, 1-year-old with pneumonia is placed in a mist tent with oxygen. What nursing intervention has priority? Give small frequent feedings, chart breath sounds. Yep, good. Yeah, because they need suction, right? Respiratory stuff. Suctioning is your number one friend, because that's pretty much just about all you can do with respiratory is suction. Because like I said, there's not a lot of antivirals that they give for respiratory illnesses. Good. What's another priority with mist tent?
We want to watch their breathing.
But what about specifically with the mist tent for oxygenation?
Oh, make sure that it's so we don't want it to be too misty because we don't want fluid to get in their lungs or more fluid to get there.
How about their temperature?
Yeah, we're gonna watch temp too.
So if it's too misty, they're gonna be more cool, right? So they're gonna be more likely to have hypothermia. So you want to make sure that you're monitoring their temperature in those mist tents specifically. Okay. Because they're in the mist tent, your whole body is essentially in the tent. Okay. It's not just the hood where it's just their head that's in the under the plastic, or not plastic, the tent. Okay. The purpose of knee to chest position in children with tetralogy of Fallot is
increase blood
flow or to increase. There you go. Increase. Yep. Increase blood flow back to the lungs so that way they can get more oxygenation to the rest of their body. Good. Okay, you're caring for a child with tetralogy of Fallot who suddenly becomes cyanotic with saturation in the 60s. What's your first action? Morphine, oxygen, knees to chest.
Oh, we just did knee to chest. What am I?
Yes. Knees to chest.
That
way they're getting that blood circulated back to their lungs.
Right. I don't know what.
See? So okay. Take a second. The first thing that jumps out at you isn't always the right answer. Right. Now, you saw 60% in cyanotic and thought, oh, they need oxygen.
100% oxygen, right?
Yep. Yep. So take a second.
Okay, maybe my exam score is right.
Oh, I think that's what's happening. I mean, and it's very common, but that happens, that thing just is jumping right out at you. But that's where I say take a second and pause. Okay. Read back through, read all of your answers before you're just picking that first thing that jumps out.
Okay.
Okay. What can cause rheumatic fever? Vomiting, diarrhea, strep throat, UTI. Strep. Good. Okay, a multiple select. So signs and symptoms of rheumatic fever include heart valve damage, chorea, polyarthritis, subcutaneous nodules over joints. All of those things. Okay. So heart valve damage, chorea, remember that's those kind of abnormal tick movements. Polyarthritis. What was that? Sorry.
Oh, I was saying I just don't remember arthritis for the kiddos.
Yep. That's a huge part of the rheumatic fever is they'll have joints, multiple pain and discomfort in multiple joints, swelling, redness, as well as the subcutaneous nodules over joints as well.
Okay.
Yep. So that all goes along with rheumatic fever. It doesn't mean every kid who has rheumatic fever has all of these things.
Okay.
But those are the typical signs and symptoms of a kiddo with rheumatic fever.
Okay.
Okay. Okay. Multi-select rheumatic fever and rheumatic carditis diagnostic findings. ESR, EKG, CRP, myoglobin. So EKG, sed rate, which is an elevated ESR,
Right.
and then a CRP. So your sed rate and your CRP are both inflammatory indicators. So because rheumatic fever is an inflammatory process, those are going to be elevated. Okay. And then your EKG is specifically looking at the carditis piece of it.
Right. The heart.
The myoglobin, we don't necessarily care about that.
Okay.
For diagnostic purposes. Okay.
Okay.
Good. Okay. VST creates a left to right shunt, leading to excessive pulmonary blood flow and pulmonary artery pressure, resulting in peripheral edema, pulmonary ischemia, pulmonary edema, pulmonary hypertension.
That leads to
pulmonary hypertension because the blood's continuing to backflow to the lungs, to the lungs, to the lungs, to the lungs. Okay. So then the heart has to work, the right side of the heart has to work harder to pump it all the way to the body because of that shunting.
Oh, okay. That makes sense. So that will make the pressure low because the other side is not doing what it needs to be.
But the pulmonary pressures are high. Right? So we're going to have pulmonary hypertension because of that overabundance of circulating blood to the lungs.
Okay.
That makes sense?
Mm-hmm.
Okay. Good. Okay, multi-select. Select all that apply. Hypothyroidism and signs and symptoms. Cold intolerance, weight gain, constipation, bradycardia. What are your signs of low thyroid?
Low thyroid. Yeah, you're not gaining weight.
You do gain weight.
With the low thyroid?
Yes. Yep.
What in the world am I thinking?
Hyperthyroid.
Yeah, I was like, wait, I'm thinking you'll get skinny.
You have weight loss with hyperthyroidism. Low thyroid, you may have weight gain. They have a very hard time losing weight. Cold intolerance. With hyperthyroid, it's more heat intolerance. Okay.
Mm-hmm.
Constipation. Hyperthyroidism, it's bradycardia. Or excuse me, tachycardia.
Right, fast.
Yep.
Okay, hippo. Let me write that.
Yep. Yep. So weight gain, cold intolerance, constipation, bradycardia. Palpitations too sometimes.
Okay.
Okay. Good. Okay. What is parallel play?
When they're playing side by side.
Yep. Next to each other, but not with each other.
Mm-hmm.
Good. Oops. Come on. Computer. All right. At what age does a child begin parallel play? 0 to 2.
Okay.
Okay.
Pick that.
No, you pick 0 to 2. Sorry. Ages 2 to 3.
Okay.
Yep. Because you picked 0 to 2, didn't you?
Yeah.
Yeah. So it's 2 to 3. Before age 2, they're really not doing any sort of like actual play.
Okay.
Yeah. I mean, they're like interacting with their toys and their environment, but they're not doing any actual actual play.
Okay. So I remember toddler.
Yep. So 2 to 3 years old. If it goes after 3, then they're kind of delayed in their play.
Okay.
Okay, multiple select. What type of infection is acne? Local, fungal, bacterial, or viral? Yes, a local and bacterial. Good. Okay, this medication treats acne and sinus infections. Tobramycin, penicillin, ciprofloxacin, doxycycline. Okay.
Ooh, Doxy.
Doxy. Yep. Yep. Doxycycline. Tobramycin is
For a viral infection.
well, no, it's an antibiotic still, but it's just not utilized that often.
Okay.
Yeah. So doxy. Minocycline is another one. Doxycycline. Your cyclines are going to be kind of your antibiotics for acne and sinus things.
Sinus infection. Okay.
Yep. Good. Usual treatment for an infant with hip dysplasia is a body cast, triple diapering, Pavlik harness, or aggressive physical therapy. Pavlik harness. Good. Yep. Good.
Remember that.
Yep. That's good. That's kind of that wonky little thing that they have to wear to keep their hips in the right spot.
Mm-hmm.
Good. Okay, another multiple select. How do you diagnose hip dysplasia in an infant? Positive Ortolani maneuver, affected leg shorter than the other, asymmetrical folds in the buttocks, or foot points inward. Okay, positive Ortolani. Okay, because that's showing that it's popping out of the socket when you're doing, that's that motion.
Oh, the in out.
Yep, where you're grabbing the legs and you're moving in and feeling kind of at the backs of the hips and then moving out. And then the Ortolani is positive, then that shows you that that hip is dislocating.
Okay. I definitely knew the folds in the butt. We was just doing that with maternity with the babies. And then if
Yep.
one leg is bigger than the other.
Yep. Yep. And with maternity as well, they talked about Ortolani and Barlow, I bet, maneuvers as well.
Yeah, the out in. That's why I was like, oh,
Yep.
out in.
Yep. Yep. So one maneuver pops it out, and then the next maneuver pops it back in place. And that's where you feel that hip click, and that's a positive test, and then indicates the hip dysplasia. Good. Okay. Which of the following are included in nursing care of myelomeningocele? Assessing urinary function using latex gloves, placing the infant in supine pre-op position, or assessing neurological function. Okay.
Yeah, neural.
Urinary function, right? Because that myelomeningocele, they don't have the sensation. Typically,
go to the bathroom.
Urinate appropriately. So you have to watch that because some of these kids have to be like straight cath because otherwise they won't urinate appropriately.
Okay.
Okay. And then the neurologic function as well. And the reason why they're not urinating appropriately is because of the location of that myelomeningocele and where it's at on the spinal cord.
Oh, it's not able, the brain can't send the signal. Okay, that makes sense now.
Yes.
Okay.
Yes. Yep. So urinary is very much tied in with neurologic function in this scenario. And myelomeningocele, another term for that is spina bifida. Okay.
Mm-hmm.
Good. Alrighty. Most important principle of nursing care with child with myelomeningocele: asepsis, exercise, hygiene, rest. Which is your most important? Asepsis.
Oh,
that pouch is without or outside of the spinal column, right?
Oh, so yeah,
So
we
you
want to
want to make
make sure
sure
they
that they're
don't
not
get
getting
infection.
infections.
Okay.
Yep. Yep. Good. Not that rest isn't also important in
Right,
recovery,
but
but
that's not the most.
that's
Yeah,
not your priority, which is what HESI and NCLEX like to ask.
gotcha.
Okay. Okay. What priority nursing action must be taken with a baby with myelomeningocele? So position the newborn supine, assist with bonding, protect the sac, or NG tube placement. Yes, protect the sac, the continence of the sac. So remember when we looked at the picture on our PowerPoint, myelomeningocele means the spinal cord is also, and all of those neurological sensors are outside of the spinal cord as well. It's not just the fluid. Meningocele is just the fluid piece, but the spinal cord is still intact. Okay.
Okay.
Okay. Nurse teaching on epistaxis management of a patient, which would be appropriate. Tilt your head backwards and pinch your nose. Lie down flat and place ice over the bridge of your nose. Blow your nose gently with your neck. Flex. Yeah. Sit, lean forward, pinch the soft portion of your nose.
Now that was new because when I would get nosebleeds, they always told us to lean back. So I was like, wait, my book says lean forward?
Yeah, lean back is not correct because you lean back, think about leaning back. All that blood then is just draining
Right, it
down the
flows
back of
down
your
your
throat.
nose. Yeah.
Yeah. Yeah. So if you lean forward, then at least if you have the blood coming out, it's draining out of your nose or out of the front part of your mouth instead of down your throat. Yep. Good. What medication would you question if a person has epistaxis? Sudafed, Tylenol, aspirin. Yes, good. Aspirin. Why?
Because aspirin will affect their bleeding, affect the
Yeah.
clot.
Yeah. So
Well, we don't give them aspirin though, because we don't want them to get raised, right?
yes.
Okay.
But also, if a kid's already bleeding or somebody's already bleeding, you don't want to give them something that will make them bleed more, like aspirin.
More. Right.
Yep. Good.
Now I'm making a comeback. It's only me.
If a baby is diagnosed with epispadias or hypospadias, what would we need to teach the parents?
Circumcision is delayed.
Yep. Good. And they delay it. Why?
Because they want to save that fat to put where they're going to do the surgery.
The tissue. Yep.
The skin, not the fat.
Yep. The skin to then resolve that epispadias or hypospadias. Good. Okay. When is surgery recommended for hypospadias?
Before potty training.
12 months, 12 to 18, 24 to 48.
12
to 12. Yep. So before potty training, remember potty training can start at 18 months.
Okay. Because I was like, wait.
Yep. Okay. So 6 to 12 months. Before 18 months, it needs to be started.
Okay.
Okay. Okay. What does folic acid do for sickle cell disease? Folic acid helps to make new bone cells. Folic acid interferes with RNA and DNA to help make red blood cells. Folic acid increases the occurrence of, folic acid helps to make new red blood cells. Good. Okay, how does folic acid supplementation aid the child with sickle cell disease? This is kind of the same.
I was question. Like, wait.
Provides iron from the child's diet. It prevents neural tube defects. It's present in, it's essential. You have to have that to make red blood cells.
Right.
So, and a lot of people don't get enough folic acid in their diet. So, having kids on a good multivitamin with folic acid supplementation, especially if they have sickle cell disease. Okay. All right, when measuring urine output of an infant, 1 gram of a diaper weight is equal to how many milliliters? 1, 2, yep, 1. Good.
Yeah, 1 to 1. I
1 to 1.
remember that.
Yep, 1 to 1. Good. Alrighty, multiple select. Signs and symptoms of pyloric stenosis are forceful projectile vomiting, current jelly stool, poor weight gain, belly distension. Okay.
Oh no, the belly distension is for the other one when they had
Yep.
projectile vomiting and they won't gain weight. The
Well, these
malnutrition,
babies won't gain well either,
right,
but their belly doesn't become distended because
right.
they're vomiting all the time. So their belly almost doesn't even have a chance to become distended.
The
Okay.
malnutrition for the belly distension is something else, though. I was thinking of something else.
Mm-hmm. Mm-hmm. I bet it'll be coming up soon. Oh, main symptom of pyloric stenosis is, yes, good, projectile vomiting.
Mm-hmm.
You may feel a mass, but you may not. So
Okay.
projectile vomiting is your main symptom for pyloric stenosis. Good. Okay. Causes for autonomic dysreflexia. Urinary retention, hypotension, dehydration, or none of these are correct. Autonomic dysreflexia.
Oh, it's automatic.
Your autonomic nervous system. So urinary retention. So your autonomic nervous system goes along with your neurologic, right?
Right.
Uh-huh. So
Oh,
if you're,
it has to send a signal to tell your bladder that it's full. Okay.
yes. Yep. Whereas hypotension and dehydration, that doesn't necessarily go along with your autonomic nervous system.
Right.
Okay. Good. That was one you had to read in your book. Okay. Autonomic dysreflexia presents with headache, hypotension, bradycardia, headache, hypertension, tachycardia, headache, hypertension, bradycardia, headache, hypotension, bradycardia. So headache, high blood pressure, and they're
So
going to have
high blood pressure.
Yep, slow heart rate because they're trying to compensate. Okay.
Okay.
Good. Okay, multiple select. Nursing interventions for autonomic dysreflexia. Bowel and bladder training, dangle feet at the edge of the bed, hydralazine for hypertension, or vasoconstrictors. Okay, dangle at the edge of the bed because if you have a kiddo with autonomic dysreflexia and you go just from laying to standing, they're going to pass out.
Oh, they'll get orthostatic hypotension.
Yep. So
Okay.
you want to do those slow transitions, okay?
And we want a vasodilator. What in the world?
Yep, not a
Yeah, that
vasoconstrictor.
green like constricted. They already can't
Yep,
breathe.
yep, they already have dysfunction of their autonomic nervous system. So they're already having high blood pressure, so you don't want something to make their high blood pressure worse, which would be a vasoconstrictor.
Constrictor, right? We want
Yep.
dilator.
Your hydralazine would be the dilator. And then bowel and bladder training because of the effects on your bowel and bladder system. Okay, because of the lack of those kind of nerve responses, that dysfunction. Okay, good. Okay, true or false? Lyme disease is caused by an infected deer tick.
Yeah, it's by ticks.
Deer tick specifically. So there's dog ticks, there's Lone Star ticks, there's all kinds of ticks, but deer tick is specific to Lyme. Okay.
Okay.
Dog ticks do not carry Lyme. Okay. Same with Lone Star ticks. Okay. Not at this point, at least. Not saying that that can't change over time.
Right.
Okay. Lyme disease treatment includes cryotherapy, nystatin, doxycycline, colloidal oatmeal.
Do they itch?
Doxy.
Oh, doxy again?
Yep. Yep. So Lyme disease, they need doxycycline, and it's for 21 days. It's a very long time of antibiotics. Okay. Because if Lyme isn't treated, then they can start to have rheumatologic effects. So they'll have arthritis, back pain, joint pain, swelling, all of that. Okay. So they have to have doxy. Okay. What is a side effect of Lyme disease treatment? Migraines, swelling, soreness of muscle, forgetfulness.
Mm-hmm.
Yes, muscle soreness. That can be a side effect from the doxy.
Okay.
Okay. Which snack would be best choice for a patient with osteomyelitis? Fruits and veggies, chicken nuggets, french fries, fruit punch. Yes, real foods. That's the best choice for pretty much anybody is real, actual foods. So not processed stuff, okay?
Right. It's like
Good.
chicken nuggets. No.
Chicken nuggets, french fries, fruit punch, all processed, full
Right.
sugar, junk. Okay, good. So if you get any sort of nutrition question and there's a bunch of junk food options, and then there's one that's not junk food, that's probably the answer.
Right.
Okay, true or false? Propranolol in the use of hyperthyroidism can decrease thyroid hormone synthesis.
LOL is a beta blocker.
You're correct. False. Propranolol has nothing to do with decreasing the thyroid hormone synthesis. Okay.
Okay.
Now, they might utilize that because you're having high heart rate.
Right, but not
hypothyroidism.
Right. It's hypertension, not thyroid.
It doesn't affect the thyroid
Right.
hormone synthesis. Yep, good.
Because our thyroid is just T3, T4.
Yeah, and your TSH, thyroid stimulating hormone. Okay. Primary use of polythyroidolol, PTU, is what I always call it, in the management of hyperthyroidism. To replace deficient thyroid hormone, increase thyroid production of TSH, decrease. Yep, good. So decrease the production of thyroid hormone. Yep, good. So that's the goal of PTU. Decrease thyroid hormone production. Okay, symptoms of a UTI in children. Not eating, cloudy dark urine, fever, or all of the above. Yep, good. All of the above for that one.
Dr. Becker, in a little bit, I'm going to have to leave. My dog has an appointment.
Oh, that's okay. That's okay. We can keep going till you have to go. Okay, recommended schedule for DTaP is 2 months, 4 months, 6 months.
6 months.
Between 15 and 18, and then they also get another one at 4 and 6.
Yeah,
between
she
4
does
and
like
6.
the well baby checkups.
Yep. 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 So that's specific for the DTaP, which is diphtheria, tetanus, and pertussis.
Okay.
Okay. All right. A sign you may note when assessing for developmental hip dysplasia. Two skin folds on the back of both thighs. Yep, there you go. One leg shorter than the other. Good. Okay, multiple selects. Which immunizations are required for school-age children? Varicella, DTaP, MMR, polio. And it was a multiple select.
Oh, okay, okay.
All
Yeah,
of them.
everything.
Yep, all of them. Good. And they get their last dose of those. Well, other than the tetanus, they'll get a tetanus later, but they get the last dose of all of those DTaP, polio, MMR, varicella at between 4 and 6,
Okay.
which is right before they're going to kindergarten.
Right.
Mm-hmm. Okay, Pavlik harness must be worn 6 hours a day, 12 hours a day, 23, or as long as the baby can tolerate it. 23 hours a day. So they get a total of a 1 hour break, which is basically getting their diaper changed is their break.
Ah,
So it's 23 hours of the day they have to wear that Pavlik harness.
okay.
Okay. Alrighty, an infant with hip dysplasia will wear Pavlik harness. What are appropriate nursing interventions? Maintain flex abducted position of the hips. Take off the harness for bathing. Direct skin contact with the harness. Administer sponge baths. Yep, good. Sponge baths.
Because yeah, I was gonna say, then they're not taking it off for a bath.
Not really. Nope, they're sure not.
Okay.
Yep, good. You have time for a few more?
Mm-hmm.
Okay.
I'm gonna have to log off by 12:45 just so we could make it
Okay,
on time because
perfect. Okay, this was a multi-select. Caregiver teaching for a patient with a Pavlik harness includes refraining from holding, understanding that the child will be delayed, checking for skin breakdown, continue to diaper around the harness. Yes.
I was just checking breakdown.
Yep, check for skin breakdown. Diapering, a lot of times it's not around the harness, it's kind of within the harness, right?
Okay.
So you're not gonna like fasten the diaper. It's just gonna be kind of propped
Oh, just
there.
oh, okay.
Mm-hmm. Because think about, you don't want to have a bunch of layers for that skin to be rubbing on all those layers. Just like when you have an older person in the bed and you don't want a bunch of wrinkles back behind them
Right.
or a bunch of layers back behind them because it's more risk for skin breakdown.
Skin breakdown, right. Okay.
Yep. Okay, nursing interventions and patient teaching for the treatment of head lice and scabies include cleaning linens, bath articles thoroughly in hot water, complete isolation from the public. Yep, good.
It was like hot water.
Yep, that hot water.
Water.
Yep, you don't need to cut off or shave all their hair, and you don't need to isolate
Right.
them.
Oh, they would be so mad.
Yeah, they would. Okay, which comment by a parent whose child has head lice indicates that the nurse's education was effective? We are all using the medicated soap to kill the lice. I frequently check the scalps of my children for
Oh,
reinfection.
mine didn't reset, but I would pick red, but mine's is frozen.
Oh, okay. I have washed all my linens in soapy water. We no longer are attending school. Okay. So, washed all the linens in soapy water. Not everyone has to be using the medicated shampoo. If parents don't,
Oh,
if parents don't have signs of head lice,
right, not scabies. Okay.
yep, yep, this is head lice. Yep.
Okay.
So scabies, everyone in the home should be treated.
Treat it right. Okay,
Yep,
never mind.
yep,
Yeah, just the hot soapy water again. I was like, wait,
yep.
oh no.
Good.
Okay, it reset now.
Okay, good. Multiple select. Which of the following nursing care interventions are appropriate for respiratory distress syndrome in infants? Suction, maintain temperature, provide adequate environmental stimuli, administer oxygen as needed for oxygen saturations 90%. Yes, good. And as far as the environmental stimuli, you would want it to be kind of relaxed, like
Okay.
not a lot of
Just
stimulus.
calm.
Yeah, just because that infant's trying to essentially breathe to survive, so their brain doesn't need a lot of other stimuli. Okay,
Hmm.
good. All right, you want to do one more?
Yes.
Okay, one more. Okay, which of the following is a mainstay of nursing care for bronchiolitis in children? Adrenaline, salbutamol, hypertonic saline, corticosteroids.
Mm,
Hypertonic saline.
saline.
Now, I will say they've done lots of studies and essentially none of this stuff works. But per your book, it hasn't updated to the latest studies. Okay. So
Okay.
hypertonic saline is something that you can do for kids for bronchiolitis. The thought is you give them that saline and it kind of helps break all that mucus up.
Okay.
So you can suck it out and so it can drain easier.
I'm gonna go back over that.
Essentially, that's about the only thing you can do for bronchiolitis in children. Now, if you have a kid with asthma who has bronchiolitis, they
Hmm.
may need their albuterol or corticosteroids or things like that. But if
Okay.
it's just a typical kiddo with bronchiolitis, albuterol, all of that's not going to help.
Okay.
Okay.
Well, thank you.
Yes, you're welcome. And then if you need anything else, let me know.
Okay.
Otherwise,